Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. I'm joined by a special guest today, Sahana. Please introduce yourself.
Hi, I'm Sahana Sundaram, currently a fellow at Baptist Health South Florida, located in Miami, Florida. Also an MHA candidate from the George Washington University.
We're so happy to have you here. We were just talking that the week of this recording, of course, is the graduation week there. So you're in DC. That's very exciting for everyone. And I think you were the second or third fellow from the Miami area that we're interviewing. It's an area that a lot of people want to go to, of course. So we're excited to share about that for all of the potential fellows who are excited to maybe move to Miami. I want to go back to the very beginning of your career here, looking at your resume, starting at Ohio State University with that bachelor's in public health. Of course, you graduated, you were dean's list there. You did very well in the program. I want to ask a few questions. The first is, how did you end up at Ohio State? And then why public health?
Yeah, so my undergrad journey was very interesting. I'm originally from Columbus, Ohio. I ended up out of high school going to a small liberal arts school, maybe about an hour out of Cleveland. When I was there, I wanted to be pre-med. I was a neuroscience major. I was really excited about it. And I think by my sophomore year, I realized that that wasn't really the path for me, but I had never really explored other options outside of that. So I was very lost. It's what I call my quarter life crisis. I was very lost, not sure what to do. And so I transferred to Ohio State to kind of figure out if there were maybe other options or other avenues I'd want to take. So I started kind of doing what I should have done my freshman year, which is taking different types of classes in different fields, kind of getting an idea of what might I be interested in. And I took some business classes. I was like, maybe I could go into marketing or operations or something like that. And I don't think I felt very motivated to pursue business alone. I think I needed something else that felt more a little bit was more purpose and a little bit more fulfilling for me in my career. And so I had a friend say, "Oh, maybe you should explore public health." I didn't have that at my other school. And I was like, "Okay, I'll try it out." So I took one class and I fell in love with it. The professor was amazing. She really made all the students really just fall in love with public health, and I realized there was so much you could do with it, and that's actually when I learned about healthcare administration, that you could kind of marry the 2, and you could have healthcare, but you could do it on more of the administrative business side. So I finished out my degree in public health, really enjoyed my experience at Ohio State, and then out of undergrad, I was, applying for jobs, and I stumbled across an opportunity to go to Fort Myers, Florida. Wasn't really Florida was never really on the radar for me, but it was a good learning opportunity. So I applied for the position and I got the opportunity to go there. I was doing mergers and acquisitions work for the last 4 years. That was really interesting. I learned so much from that because I never really had experience within the administrative field. It was always more public health work that I was focusing on. But my supervisor at the time really wanted to mentor young professionals. And so he, took me on as his employee. He taught me a lot and I got to really experience working with different departments, which I think one really good thing I learned is how to work with people and different personalities. And then the other part is also learning about what each of these departments do, because I'm not an expert in any of these departments. I don't know tons about it. So I think getting the opportunity to learn from each of these departments and what they do and how they play a part in healthcare, I think is really important. But I was in mergers and acquisitions. Basically, what we did was acquire oncology clinics that were interested in joining our network because we offered centralized services that would kind of take the burden and the workload off of those smaller clinics. So I did that for the last 4 years.
That is just so I'm really impressed because it's a different path because you kind of have individuals who have a few years between, but it's almost from the looks of it, you were working while getting your MHA.
At first, I was just in Fort Myers. I was just working. I needed a break from school. I just wanted to take a little break. And so I was just doing my job. And then we hit the pandemic, I think 9 months into me moving there. I always knew I was going to go to grad school. It was just a matter of when and what program I wanted to pursue. And so at that point, I felt pretty confident in wanting to do healthcare administration. And that was just seemed like the perfect time to apply for programs because, we were in the pandemic. I'm like, I can sit down after work and focus my time on applying. So I applied to a couple programs. I want to say like 5 or 6 programs across the country. And yes, I did eventually get into George Washington University, and I did work while going to school, which was I'm very grateful and lucky that I was able to do that.
How were you able to do that? Because, the mergers and acquisitions field is pretty challenging. You have to prepare quite a bit. Some of these meetings can be pretty intense. I know partnerships as well is very challenging. How were you able to maintain, kind of a more senior role while also going to school? And GWU is a pretty rigorous program, right?
Yeah, I'm not gonna lie, it was difficult at times. I really didn't want to feel like I was splitting myself and my energy amongst too many commitments. So I was nervous going into the program because I also did the full-time residential program, so I was going in person to my GW classes. But I was very lucky that my supervisor, and he was a mentor to me at the time, or even now, but my supervisor at the time, he was very willing to work with us because he did care about our professional growth. And so he encouraged me to go for the program. We were fully remote at this time because of the pandemic. We knew we could be remote. So at this point, my coworkers were living all across the country. So I knew living somewhere else wouldn't be an issue. It was just more of like, how do I balance my time? Luckily, because we had so many people in different places, that affects the time zone and when we'd have certain meetings. And so I was able to like flex my time a little bit and schedule meetings during certain hours when I wasn't in class. And a lot of the GW classes were in the late afternoon, evening, anyways. So it kind of worked out where I was, I get up in the morning, work as long as I can. And then after work, like I would try to have all my meetings like during the business day. After school, I would come back and try to, catch up on any other items if there was anything else pending that I needed to complete that day, along with my schoolwork. It wasn't easy, but I will say I think I was motivated I was very productive because there was not a lot of free time that I had. So I had to utilize the time I did have to get things done.
That is great though, because you have this experience now in a very important area. And then also that probably helped with any loans or expenses, having not just an entry level job, but a senior kind of managerial position. So that's wonderful. Why did you choose to go to a program that has that required fellowship when you already had, pretty well paying job? What was the reason for wanting to do that?
That's a great question. I wanted to do the fellowship program regardless of which school I went to. I think being in the role I was in, it was very siloed into oncology, and mergers and acquisitions is a very I feel like niche role or skill to have. And so I wanted to see if there was something else out there that I would be interested in. You get to touch a little bit of everything. And I also was interested in hospital systems. And so I wanted to work in a hospital, see if that's something that I would be interested in the future and get that experience. So it definitely was a lot to consider with, like salary and also like, what opportunities are out there, especially because now I'm learning that I don't have a clinical background. So I think that's also a challenge in itself. And so I think it's really opened my eyes to a lot of aspects of healthcare and just the different things you can do. But that's kind of why I wanted to pursue the 3-year program because I was interested in the fellowship. And GW does have a great program in general.
So what fellowships and what was that application process like? How many did you apply to? And, why did you apply where you applied?
I'm trying to think back to when, I was applying. I think that was in 2020. I applied to 6 programs. I want to say, I think 3 within the DMV area. And then applied to Ohio State again and a couple other programs. I can't remember at the top of my head, but more on the East Coast. I wanted to stay on the East Coast. I was considering areas that I thought I would live in. I didn't realize with the fellowship you could move anywhere. I thought wherever I go to grad school is probably where I'm going to end up for the next couple years afterwards. So DC had always been I love DC and I really wanted to move out there. It also is a public health hub, so I thought there'd be a lot of opportunities out there. So that's why I was very intrigued by it. I did consider Ohio State as well, but I think considering that I grew up in Columbus and that I did my undergrad there, I wanted to kind of switch it up a little bit and do something different if I was able to.
Would you recommend doing something different? Do you think it's helped to broaden your horizons?
For me, yes. I recommend everyone, even if it's not for school, just moving out of the state or out of your city once in your life. When I moved to Fort Myers, that was a big, like, personal growth period for me because I didn't know anybody there. So kind of having to start over. I grew up in Columbus. I went to school in Columbus. So like I had childhood friends, high school friends, undergrad friend. My family still lives up there. So leaving that and going somewhere where you know zero people, it's very eye-opening, and I think you won't really understand it until you experience it, but it's been good. I definitely think people, if they wish to do that, I think I would definitely recommend at least one time in your life moving somewhere else.
I absolutely agree. I absolutely agree. So, when it came to the fellowships, that third year of the program, you're nearing, of course, the completion of your fellowship, the graduation of the program. But what was the applying for fellowships like? How many fellowships did you apply to?
I think I applied for like 15 fellowships. The thing about the year that I entered grad school is it was right around the time COVID was sort of settling down. And so our cohort was double the size of a typical GW cohort. And I'm sure many other programs took on many, like, more students than they have in the past. And so then when everyone's applying for fellowships, it becomes a little bit more competitive, not even with your own class, but then you have to think about other students that are interested in fellowships as well. So I was trying to keep my mind open. I will say at first I was very set on staying in DC. I wanted to stay in the DMV a little bit more long term. I wasn't quite ready to move yet. But then I kind of thought about it a little bit more realistically. And I said, okay, like if DC doesn't work out, there's only, I think, 2 or 3 programs within DC. So realistically, it might not work out. And it didn't. And that's okay. But where can I see myself going? So I focused a lot of, I did apply in other states as well, but I focused a lot of my applications in like the Boston, Chicago, and Miami area. And then I got paired with Baptist, which was, it worked out for the best. I'm really happy that I'm there. So, but yes, I probably applied to, I want to say like 15 programs. Not that everyone did that, but that was just my choice.
Why Boston, Chicago, and Miami? I've heard Chicago, New York, and LA that I've heard a few times, but what was the reason for your three focuses?
I've been to all 3 cities and I enjoy all of them. I'm from the Midwest. I like the East and the Midwest areas. I mean, I lived in Florida and I was open to moving back there, but I wanted to try more of the East Coast. I think I like the city life and I like the energy of a city. And so I think that's why I was focusing my energy in those places because I'm like, I can see myself maybe, for at least the next 5 years living somewhere. You never know where you're going to end up. I did not know I was going to end up in Miami realistically, but then here we are.
Congratulations on getting that fellowship in Miami. And so it's at Baptist Health. Can you tell us a bit about what Baptist Health is like, what it's like working there, and then just your overall experience in the fellowship?
Yeah, so I didn't actually know about Baptist Health South Florida before, looking into the application process. So I did a lot of research, and I had a few friends that also were applying to different programs in Miami as well. So we would talk about all these things, and the more I looked into it, I was like, this could be something I'm interested in. And so, they talk about really caring about their not only their patients but their employees, which I think is really big for me, and I really appreciate that kind of culture. And so I was very intrigued by it. And when I interviewed, it was a panel interview. So there were maybe 5 or 6 individuals on the interview. Everyone was very kind and welcoming, and I really appreciated that. And I think I felt more at ease and I could be more myself because of that. I also really liked we do a leadership certificate program. So that includes getting your yellow and green belt for Lean Six Sigma, which I think is extremely important. I'm learning a lot from experiencing that and being part of that. So that's really great. You get to meet a lot of leaders and do a lot of networking within the system. So I've gotten to tour all the hospitals in our system. We have about 11 or 12 hospitals, from all the way from the Keys up to like Boynton Beach, which is north of Boca Raton and Fort Lauderdale area. So that's been really great networking with people, and everyone's very open and welcoming and willing to teach you. I think that's really big because, nobody knows everything. And as a fellow, we're learning so much that um, it's just really nice to see people that are willing to teach. I think it was just more of the fit and the energy that I was like, okay, this is something I could see myself maybe doing, but I didn't know a lot about Baptist Health. So I still was very nervous going into it. I've never even been to, well, I've been to Miami, but I do live in Fort Lauderdale because I'm kind of go between the region and South region. So I didn't really know a lot about Fort Lauderdale or even really north of there. So again, it's like a new, like a lot of personal growth, professional growth as well. And I don't know that I want to keep moving, but I think those experiences for me have been extremely beneficial for my own growth.
Oh, yeah,
Um,
absolutely. Wow. That is really great. And, moving is a big pain, of course, for social, emotional, and of course, physical reasons. I just moved about 4 blocks and it was a tremendous challenge. So it's, I can understand that, but it is a real, area of growth. And I appreciate you highlighting that. What are some of the, your favorite projects that you've worked on or the favorite rotations that you had? If you had to, just say a few of your favorite experiences from the fellowship.
yeah, it's been really interesting actually because so just to give you a little background, there's Miami-Dade County, Broward County, and then we have Palm Beach. I live in Broward County. We don't have any, well, we have outpatient centers in Broward County, but we don't have any hospitals. And then Palm Beach County, we have 3 hospitals in that area. And then Miami, of course, like there's 8 or 9 in the Keys. It's very interesting to see the cultural differences between the North and South region because the like population is very different. I would say the North region is not as diverse. It's a little more of an older population. The culture is a little different versus you go to Miami, it's a lot more like Latin heavy. I mean, people of all ages, but it's just like very interesting to see the different dynamics. So that's been very eye opening as well for me. I really enjoyed. I've been spending more time in the North region. That's where they've like placed some of my rotations. So I really enjoyed working in the hospital that I'm in, which is a 70-bed, like smaller hospital. But it's a beautiful hospital. The people that work there have worked there for like 15 years since that hospital had started. So it speaks a lot to the leadership there. And I got to really observe and witness a lot of great leadership while I spent my first rotation there. So that was really great. I'm currently doing a rotation with patient experience, which has been really great. I do a little bit of data analytics work, which has been fun, but then I also get to do more people facing work. I do think in the future I want to do more people facing work, but I enjoy the data analytics as well. So I think having projects where I get to kind of dip my toes into different types of projects and different types of work has been really good to figure out what I want and don't want. One of my interesting projects, I'm currently working on a system level project looking at sitter usage and evaluating how each hospital, if they, utilize sitters or if they have a telesitter program, and then kind of determining, does your process work for your hospital? Is there a better alternative? Because what we want to do is reduce the risk of patient falls and injuries. So right now, I'm currently working with the chief nursing officer of the system, which has been also amazing. She's wonderful and very kind, and it's been great experience learning from her as well. So that's been great. I've been meeting with a lot of leadership, and I think it really exposes us to a lot of things that I don't think I would have, had the opportunity to be exposed to otherwise.
Nice, very good. And what are your findings so far on the sitter program? Anything interesting that you found?
Yeah, it's been interesting because I think it's difficult when they do hire from agencies, which is expensive when you're using a third party. And then also for the sitters, they're not allowed to use their phones or really do much. And I think they're not as engaged, gets really difficult because they might fall asleep or they might not be paying attention for a split second. And a patient might try to get up and then they fall and they injure themselves. So we're working on potentially getting a telesitter service. However, then you have to think about, like, if you have to get a camera in each room, that's a cost that you incur. Maybe there's another alternative. Maybe we hire in-house sitters that are, employees of Baptist. And so that way, I don't know. We're still doing a little bit of research on that. So I don't have any definite answers, but it has been interesting to see like every CNO of each hospital has a different opinion. So it's been interesting to get their opinions. And then I kind of formulate my own thoughts on that as well. So hopefully in the next month or so, I'll have something more concrete. But as of now, still kind of in the research phase of exploring different options and best
It,
practices.
it helps us to see how kind of in depth, with things that you get as a fellow. You're in this project and having to get all these different opinions. That's really cool. I think you should use pre-med students and put them in there. No, but really, that's very interesting. That's awesome. So that's great. And so let's talk about that Fort Lauderdale area you're living in, the Miami area. As you know, we have the rail construction, you have all kinds of apartments coming in. And a lot of people from the north are now, it looks like, moving into Miami, especially some of the wealthier population. It looks like. What is the area like? Do you enjoy living in the area? What's it been like for you?
So, like I mentioned before, I had never been to the Fort Lauderdale area previously before moving there. I showed up on move-in day, and so that was, I didn't really have much of an introduction. But I think I've been there almost, I want to say 10 months now. So I definitely feel more settled in the space. I think initially being from up north, I was, you have this idea of what Miami is like, and you're like, I want to live in Miami and have all the fun. And there's like so much to do and a lot of culture. And I think there's a lot that you can appreciate about it. But I think there's also one little sliver that we see. And then there's just like Miami is huge. So you just have so many different people of different income levels and cultures and all kinds of stuff. So it's definitely, I like going into Miami, but now being in Fort Lauderdale, I definitely think it's a little bit quieter, although there are things to do. Miami's a little bit congested. So I don't know that long term I personally want to, although I would move closer to be there. But rent is also extremely expensive. And I talk to people all the time about how people want to buy a house, but it's just the market's not really great right now because it's just so expensive. And so it's forcing a lot of locals to try to move more up north. But then, like you mentioned, there's a lot of people that are like very wealthy coming from up north who are moving to Miami and, doing their thing there. But I think I really do enjoy Fort Lauderdale because it's close enough to Miami if I ever want to go. It's sometimes a little inconvenient to get there because it's about like 40-ish minutes, give or take, and depending on traffic. But I would say it's slightly cheaper. I wouldn't say it's, even that much cheaper. Just South Florida it's becoming very expensive to live out there.
Is this a place where, with the fellowship salary, that you have to have roommates, or is it an area where you have your own apartment? If just give what that life kind of feels like for some of the potential fellows.
Sure. So for me, I do have a roommate. I think that was the best decision for my like situation financially. I did take a slight pay cut to do the fellowship, and I was willing to do that, and that was something I knew going in. So I was like prepared for that. I have a roommate now, so I was totally fine doing that. One of my fellows, both of my other fellows are from Miami, so they're more local and they understand how the housing works there. And one of them lives in a house with a few roommates, and one has her own apartment.
Everyone is going to have a bit, I know that in New York City as well, some people can sleuth out these great apartments, and then others, you have to have the roommates. But it's good to kind of give that honest take because of the hype going on in Miami right now. People like the weather and everything. So it's good to show different sides of it. I really appreciate that. I want to ask as well, for these potential fellows or even potential MHA candidates, are there any pieces of advice that you feel like has been pretty transformative for you that you'd like to share?
Yes. So I think with the fellowship in general, I don't know if I realized that it's not very structured in terms of you don't go in there and they say these are your assignments and you're going to be doing XYZ on these days and you're going to spend your time doing this. It's a lot of exploring and learning what's out there and hopefully find like you do get assigned to projects, but sometimes you might stumble on a project that you're interested in working on and you kind of ask if you can help assist with the project, or maybe some of your work is a little bit more observational. It's a great opportunity to get your hands in different types of work and meet with a lot of people. I think that's been amazing for me. I think what was difficult at the beginning was just a lot of the unknown of like, how do I spend my time very efficiently? Like I want to, be very productive, but sometimes I'm not sure like what I can do to be, to contribute and benefit the system. So there were times where I'm trying to seek out projects, and I know a lot of my fellows, not only within my system, but other of my classmates that are doing fellowships as well, have had that inner battle of how do you balance your time? How do you feel like you can make the most of your fellowship? Because sometimes there isn't, a set concrete list of things for you to do. You kind of have to search for it a little bit. I knew that going in, but I don't think I was as mentally prepared for it until you're experiencing it. Our system also went through a reorganization right when we started the fellowship. So that was difficult too, because, people are so scared, not really knowing, are we going to keep our jobs? How are things going to look in the future? And a lot of that has settled now and everything is, worked out, I guess, how it's supposed to work out. But it was tough. Like a lot of these people, Baptists, what is really amazing about Baptists is a lot of these people have worked together for 15, 20, 30, 40 years and have stayed within a great organization. And so then when you have to say goodbye to some of your coworkers and even friends, it's extremely difficult. And then there's three of us who are new to the system, kind of hopping in and not really sure like how we can be of assistance and what we can do to help during that time. So there were some challenges for sure. I think any fellowship, though, it's like I mentioned before, not having the structure is really difficult. And you just have to experience it and kind of go with the flow and do the best you can. But one thing they really reiterate in our fellowship is being comfortable with being uncomfortable. You're going to be uncomfortable a lot of the time. And that's definitely happened to me many times. And you just have to kind of, again, go with the flow and just kind of ride the wave, and everything will work out how it's supposed to. And I think now, I mean, I don't want to speak for my co-fellows, but I feel that all three of us are a little bit more settled into the role, and we have a little bit more ease when it comes to navigating the fellowships.
Just as you're nearing the end.
Well, I will say this, my fellowship started at the end of July, and it ends in August.
And where do you know what you're doing after yet? Do you have anything lined up?
No, not yet. I'm looking into jobs. This is like the time to start the job search, having those conversations with other leaders, seeing what opportunities are out there, looking at the job boards, networking. I personally do want to stay within my organization. I really am enjoying the people and the work they do. And I think there's a lot of great opportunities there. I'm also staying open-minded. I'm not from South Florida, so I'm not tied to staying down there. If I need to move, I'll do that. But I would like to stay at Baptist. So we'll see how things work out. I think, everything will work out for how it's supposed to.
It's really nice to hear it when fellows want to stay with their organization. That's excellent. And really good advice on how you've overcome those challenges. I really appreciate that. And I appreciate you coming on today as well and giving me a bit extra of your time. Hopefully we can have you on again once you get this new role in a year or so now and you're settled into that role. We'll have you back on to talk about the challenges you've overcome there.
I appreciate it. And thank you so much for, having me on here. This has been really great. So thank you.